Hello, listeners, and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science and realities of living a long, fulfilling life. So sit back, relax, and join us as we go beyond the mirror.
Welcome, listeners. We are so excited to have you here today. We have such an amazing hot topic for you. And we have the lovely Rachel Weilandich, and she is here from Resilient Training and Rehab. And Rachel, you have been in the physical therapy world for quite a while. And your journey and your story is quite interesting. Share with us a little bit about what made you choose PT and how you got to where you are currently.
Yeah, of course. First off, I just want to say thank you for having me. I've been in the physical therapy world now 6 years, but I've been interested and I've had experience in the physical therapy world on a personal level since I was 15, and I'm 30 now. So that's a lot longer than that. And to dive into how I became a physical therapist, I went through my own medical issues. So if you've ever heard of what's called scoliosis, I have it. And so I've had 3 back surgeries. I knew wanted to go into healthcare and help other people. And how I ended up as physical therapy is I tied it into my love for dance and the human body and learning about muscles. So that's how I got into physical therapy. I ended up going for undergrad and graduate school at St. Louis University. Go Billikens. And so I really enjoyed my journey there. And once I got into the corporate world, decided, I need to take things a step further. I knew I've never had a traditional physical therapy approach, which I'm sure we'll get into, but I knew physical therapy needed to be more than what it is. And that's how I got into Resilient Training and Rehab.
Yeah. And I'm sure that some of our listeners have experienced a little bit of the frustration that we deal with insurance. And so that sometimes can be right? And sometimes that can be a motivator to find other ways to get what it is that we need. And that's really what you did, right?
That's exactly what I did. So a little background on that. I had been in corporate physical therapy for about 5.5 years. And it was getting increasingly frustrating to give patients the care that they needed and deserve. If you haven't noticed, insurance deductibles are going up while insurance reimbursement is going down. And so the more that a client is paying for insurance, unfortunately, the providers are actually getting less and less reimbursement, which means that they have to see more people at once to get money. And it's not always about business, but it is a business. And so what's been happening in the corporate world is insurance reimbursements are going down. Numbers are driving physical therapists to have to see more and more clients. So a lot of times you're going to go to a physical therapy gym and you're not going to be the only patient that your physical therapist has. They're going to have 2, 4, upwards of potentially 5 people that they're treating at once. And if you haven't noticed, we all only have 2 hands. And so there's only so much we can do in that setting. And what I wanted to do is I said, I've had enough. It's time to make a difference and to give people the one-on-one care that they truly need and deserve. And that's one of my main goals in Resilient Training and Rehab is every single session is a 100% one-on-one. So although we don't take insurance, it's to give you the highest quality of care possible.
I mean, sometimes I've been saying this forever because I actually have sympathy for medical doctors and understand that the reason that you have that, you go to the dermatologist, they see you for 3.5 minutes, they do a full body check in that time, and then they're out the door. And I know as like receiving care, it stinks, but I also understand like for them to even cover the bills, sometimes that is literally what they have to do. And so I do have sympathy for that. And, and I'm sure it's the same for you guys. So I've been paying for out of pocket medical stuff for quite some time because I knew I couldn't get the real medical care that I thought, I mean, I was having an issue I thought I could get, and I'm sure it's the same with physical therapy. It's cool that you're
Oh yeah.
breaking out that mold.
Yeah, it's 100% that. It's not, I don't think there's, I'm sure there's a few, but I don't think there's many people in the healthcare world that are doing it for a profit. None of us went into healthcare for the sole thought of money. But in reality, we all have families and we all have jobs just like everyone else. And we want to help people, but at the end of the day, we still have to consider, what we're bringing home and how we can support our loved ones as well. So I feel for people. I mean, having been there and having been in healthcare and been in the corporate world, I feel for doctors when they have a turnover of every 5 minutes, because that's not the care they want to give either. It's just where reality is at right now.
Yeah, absolutely. Pivoting into what our main topic is today, this pelvic floor, this
Yes.
has been such a huge up and coming, topic, and you have really honed in on that, and
Yes,
that
ma'am.
has been your specialty. So for those listening that don't understand what the pelvic floor is, give them a little backstory on what that is.
Yes. So pelvic floor is definitely my area of love. Your pelvic floor is the area of muscles, and for lack of a better way to describe it, it's the area between your legs that we're talking about, folks. And so your pelvic floor are the muscles that help to support their abdominal cavity. They also help to control bladder and bowel. So some of the things that we really focus on in pelvic floor are bladder problems, bowel problems, sexual dysfunction, or painful intercourse is a big topic as well. There's other things, there's a plethora of topics we can get into, including how pelvic floor actually ties into so many more orthopedic conditions. I can't describe to you how many people with back pain or hip pain, it's actually all coming from their pelvic floor. And so this cradle of muscles that holds your organs and holds everything together contributes to so many parts of your life. And to be honest with you, they contribute to very enjoyable and important parts of your life. So it's important to take care of them.
Absolutely.
Yeah, totally. Oh my goodness. And like so many things really depend on that. So let's kind of let's dive into the bladder first, because we have a lot of women when you get to be our age that consider doing a bladder suspension because I can't even tell you how many times I've had this conversation just this week about how many times we pee our pants.
Yeah.
Right? No, I've been saying to my kids forever, since no jumping jacks for me. Like there's just certain things as
that
we
we're
age.
gonna hold off on. And I'm going to tell you something. The thought of as you get older, you can't do jumping jacks, or the thought of I'm older, or I've had kids, so I have to go to the bathroom every 10 minutes is actually a lie. It's something we've kind of told ourselves to make it normalcy. And let me tell you, folks, to everyone listening, it's not normal. Okay. It may be common, but that doesn't mean it's normal. So when we talk about the bladder, there's a lot of things we can do. Now, when it comes to bladder lifts, that's something that relates into what your doctor may call a prolapse. I want everyone to know here that when it comes to prolapses, there's 4 different grades. Just because you may have been told that something is prolapsing or if something is, and to describe what a prolapse is, everyone, a prolapse is when one of the organs in that in that abdominal cavity region, so that would be uterine or uterus, bladder, or rectal area, that's when one of those start to fall towards or fall into the vaginal opening. Nothing is going to fall out, okay? It may feel like it's going to fall out, but that doesn't mean it's going to fall out. And so when we talk about needing a bladder lift, a lot of people think that, well, because I just have laxity there, I need something extra. And what's really important to know is your muscles are that extra. So unless you have a very serious prolapse, and it's graded on a scale of 1 to 4, grades 3 and 4 are potentially surgical, but not necessarily surgical. When you have a prolapse, you can train your muscles to hold those organs up for you, which is one of the beautiful things that pelvic floor physical therapy does and trains, is how do we teach our bodies to hold these organs up for us. But in addition to that, I like people to know your needing your bladder lifted or needing things lifted isn't the only thing that causes urinary urgency or frequency, or leakage for that matter. So those are things that we dive into as well in pelvic floor physical therapy.
So for somebody who is like, oh my gosh, like I need to do something. I am so tired of, wetting myself.
Yeah.
How long do you normally work with somebody before they see the results of that suspension and their own muscles taking effect?
Yeah. So I joke here because one of the best physical therapy answers is it depends. But everything depends on the person, right? So twofold, depends on why you're leaking. So in the instance of a prolapse, right? So in an instance where things are kind of saggy, for a lack of a better way to put it, I would say I usually will see someone for somewhere in the 6 to 8 week realm, where they're by 6 weeks, usually people are feeling really darn good. Doesn't mean that you're 100% symptom free, but you are doing significantly better. And one of the beauties of pelvic floor physical therapy is we really work on diving into how can we make treatment part of your daily life. So I usually see people one time a week at that realm. And so one time a week for about 6 weeks, at which point we see how the client's doing. And then we go into like every other week or eventually and hopefully once a month to finally graduation day. When it comes to urgency and frequency, what a lot of people don't realize is they've actually created some really bad habits in their life. And those bad habits are what's causing them to have to go to the bathroom more often. So I have seen results as quickly as, goodness, I've had people make significant improvements within 2 sessions. Now, I always say 4 to 6 weeks is optimal to at least get some good improvement and for people to feel really confident with it. But bad habits, not only strength. Yeah.
What are some of those bad habits?
I was going to ask that too.
Yeah. Let's dive into them. Let's dive into this. So bad habits that lead to urinary urgency and frequency. And for to kind of give a definition, okay, a healthy bladder only needs to void every 3 to 4 hours. So realistically, women, you should only have to go to the bathroom to go pee every 3 to 4 hours. Okay.
Even if you're crazy and you're drinking like mass quantities of water, is that still the situation?
It varies. And that what I would say is depends on what you describe as a crazy amount of water, but it also depends on your irritant intake. So what do I mean by irritants? I think everyone kind of jumps first to coffee and caffeine and sodas, right? But an irritant is actually anything that is not water. So you have coffee, you have tea, you have soda, you have decaf coffee and sodas are all still irritants. If we talk about foods, acidic foods are irritants. So people that like to put lemon in their water and only drink lemon in their water, you've actually made your water an irritant. Okay. Now, is a little bit of lemon in your water as bad as a soda? No, but it is an irritant. And so what we do is we focus on, okay, what is your irritant intake versus your regular water intake? Okay. So a good example is if everyone were to take their body weight, okay, divide that by the number 2, that is the number of fluid ounces of water you should be getting a day. And that's an approximate, okay? And that also includes water from food. So like if you eat an apple or a melon that's got more fluid in it and water in it than, let's say, a sugar cookie, okay? As much as we love sugar cookies. So, but when we look at that water intake, we go, that's as much water as you should be getting in a day. Now, to answer your question on, well, what if you're crazy and you drink a bunch of water? My question would be, how fast are you drinking that water? So our body can only absorb 4 to 6 fluid ounces of water an hour. All right. So if you were to have a glass of water by you, which I highly recommend, if you're going to drink your water, you keep your water with you at all times. Okay. And you should sip on it throughout your day. So you sip those 4 to 6 ounces throughout an hour, and then you sip it throughout the day. Someone that's going to have more urgency or frequency is going to be what I call, you just dunk it. Okay. I drink, like, this would be a quintessential answer. With breakfast, I drink a full 20-ounce bottle of water, and then I don't touch water again until 2 o'clock. And then, I have to take all my pills before bed. I'm going to drink another bottle of water. Well, I can guarantee you that that last bottle of water is going to make you get up and have to go to the bathroom during the night because you drink it too late. Does that make sense?
Mm-hmm. Of course. Yeah, absolutely.
Yeah.
How do you feel about the electrolyte powders and stuff like that? Do you know much about?
That's a great question. So they don't replace water. So think of it this way: electrolytes really should only be replenished if you're doing some significant physical activity. So electrolytes break down into pretty much salt. Okay, so if we're talking salt or sodium, which can be dehydrating. Okay, so a good example, right? If we were just sitting here talking like we are now, you shouldn't really be drinking a Gatorade. Okay.
So I'm talking more about the
same thing.
Like the element salt and the reason I say this is my son and I are both vasovagal. So if we're dehydrated, we're more likely to get lightheaded and pass out and all the scary stuff. But we've both found by adding electrolyte once a day that stops.
Yeah.
We just don't
No. And so what I would tell you there is that's balance. So there's nothing wrong with having one of those electrolyte packets a day, right? Because you're vasovagal. So we're balancing some other things going on right now, right? So now you've got electrolyte packet once a day. What I tell you is potentially too much is if that's the only way you drink water.
Yeah, no, we don't. We both then drink regular water. Like we start the day with the electrolyte and then drink regular water the rest of the day. And I don't really drink anything other than wine and water and coffee.
Those are good things to drink. So I like to tell people too, when you go into the pelvic floor world, right, you can go and sit down with a pelvic floor therapist and they're going to tell you you hear all these irritants, right? And you're like, dear goodness, does this person not like fun? Like, how are we going to go through life and not have coffee? And I'm going to tell you, I drank my coffee this morning. Okay. But as a physical therapist, as a woman, as a mom, as a wife, I know that there's balance in everything. Okay. So if I have a client come to me and they go, well, here's my list of things that I've eaten throughout the day. I go, okay, let's look at this. I'm fine with you drinking your electrolyte water. It doesn't seem that, and usually what I have people do is a bladder diary. So what they'll do is they'll document what they eat and drink, and then they document when they go to the bathroom and how long they were going to the bathroom for. So for instance, if you start a stream of urine, how many seconds does that last, kind of thing? Because that gives us a good picture of if there's complete or incomplete emptying. But I'm not going to look at this bladder diary and tell everyone, like, all you're going to do is drink water now. Because I'm going to tell you something, that is extremely unrealistic, and I don't think anyone would be happy, right? So we have to take a look at how do we balance our coffee intake. Now, what I can tell people is if they come to me and they go, so I drink, let's say 3 cups of coffee a day. I drink 2 in the morning, 1 in the afternoon, and they do fine all morning. And then all of their urinary urgency or leakage happens after that 2nd cup or that 3rd cup of coffee in the afternoon. Guess what I'm going to tell them? Their limit is probably 2 cups. But everyone's limit is different. And all that goes down to how you're designed, how much water you get, how much exercise you get. It all plays a role. And so that's why it's so important to take a look at each person individually. That's why it's so important to have the true one-on-one care. Because if I were to just hand you a sheet of paper and say, here's all your irritants, good luck, you're not going to get better. No one's going to get better. I wouldn't get better. Right? Which is why it's so important to take a deeper look.
So what are some of the other bad habits? So, the first question is, how are you drinking your water? How much water are you drinking, and how are you stretching it out through the day?
Yep. So what's other bad So here's another bad habit that I think I'm going to say almost all women, but that's just because I know me too. Just in case peeing.
Oh my gosh, I'm the queen. I am the queen of the just in case pee.
So is that not good?
I am so paranoid of getting stuck on the highway, getting trapped in a meeting I can't get out of, and having to go really bad. I am the just in case peer.
Yeah. So if you think about the other side of it is having a full bladder and not being able to go, that stresses it so much, and so it's like, which way do you go? Which way?
Again, it comes down to that balance again, right? So I definitely ascribe to saying that just in case peeing is bad. There's a couple times you have to do it, and a couple times I allow it. Okay? There's 2 instances that you have to just in case pee. And now I'm a pelvic floor physical therapist, so when it comes to talking about intercourse, I have 0 filter. So just so everyone knows, you have to just in case pee before you have intercourse and after you have intercourse, okay? That is for cleanliness. That's going to help clean the area. It's going to help prevent UTIs. It's super important, okay? That aside, the only other time I start to tell people that they can just in case pee is if they know they're going on a long road trip, okay? I don't think you should have to just in case pee every time before you get in a car. Remember, that healthy bladder should hold your urine for 3 to 4 hours. I'd say 3 hours is really optimal. 4 hours is great, but if I can get someone to 3, I'm perfectly happy. And so what happens, let me explain why just in case peeing is a bad habit, okay? You have this connection between your brain and your pelvic floor. This connection exists for your brain and all your other muscles as well, okay? But there is a significant connection between your brain and your bladder and your pelvic floor, all right? Your bladder has this thing called Bradley's loops. Please know you never have to remember that. But Bradley's loops are these 3 different warning labels or warning signals that go on in your bladder. Okay. So as urine rises in your bladder, these different signals go off. Signal 1, which is the lowest, okay, says, my bladder's filling. I'm drinking water, but I'm okay. All right. Signal 2 is, I'm getting pretty full. I should probably look for a bathroom in the next 30 minutes to an hour. Signal 3 is the only time you should have healthy urgency. And that's, I need to find a bathroom very soon. Okay. But what happens is when we just in case pee, we actually start training our brain to think that signals 1 or 2, those 2 that shouldn't be the red flag warning, I got to go to the bathroom, we're actually making that signal come down. So now that 3rd level signal is happening at level 1, or that 3rd level signal is happening at level 2. And so that's when someone goes to the bathroom, right? And they're going to the bathroom every 30 minutes to an hour, okay? And they go to the bathroom and it dribbles. Or they go to the bathroom and there's nothing there. And then they get up and they go around and they got to go again. Because that bladder is just getting a little bit of urine in it before it feels like I've hit that red warning, I got to go. So that's why just in case peeing is so bad. It actually can train your brain to not recognize what's full and what's empty, or what's full and what's partially full when it comes to your bladder.
Wow. Yeah. Who knew?
I'm doing everything wrong.
I know. I was like, we need help for this pelvic floor.
Well, women are. It's okay.
Yeah, I know. Right. That's why we're here. We're all getting educated.
Yes.
Feeling like I need to pee right now.
That's what happens when you talk about it too.
I do not have to just in case pee right now. Thank you.
So you brought up the topic of sexual intercourse, and
Yeah.
I know a lot of women have either painful sex or some sort of issues with the pelvic floor when it comes to sexual health. And so I do want you to talk about that a little bit more. Is there a tie between, my question is there a tie between painful intercourse and C-sections that you have noticed at all?
So what I will tell you is there can be with C-sections. There's also, though, a tie between painful intercourse and vaginal delivery as well. So what I'm going to tell people is it's not necessarily about the type of delivery you have. It more is, how did your delivery go? And so let's dive into the postpartum area for a moment, right? Because there's a lot of reasons people have painful intercourse. Okay, there's a lot. But when we look at being postpartum, let me tell you, ladies, your pelvic floor has gone through a lot. And it's not just about your delivery, it's about those full 9 months. Okay. Your pelvic floor is holding that growing uterus and that growing baby up. So I don't want anyone to go into a C-section thinking that they're saving their pelvic floor, because they're not. Their pelvic floor is already gone through stuff. Okay. C-sections usually lead to more of a scar tissue type of pain. So if someone has a C-section, the way that scar is cut is not fantastic for healing. The incision has to happen the way it has to happen for safety reasons, okay? Like, you have to be cut that way to get the baby out. That's super important for mom and baby. But when it comes to the C-section and the healing, a lot of times what happens is we just don't touch the scar, or we avoid it, or we avoid strengthening our abdominals, or we strengthen our abdominals in an unhealthy way. And all of those things can lead to painful intercourse. When it comes to vaginal delivery, you'll have women that tear, right? So we have our perennial tears. You have scarring, you have all those things that can happen with delivery. Those types of delivery complications, or needing stitches or needing anything like that, can lead to some scar tissue, which can also cause pain. Now, what I'll tell you is, in my practice, I have found less and less that the scar tissue is the main culprit of the pain, and it's actually some different muscles that are the main culprit of the pain. Think of it this way. You have a muscle that has been holding a baby up for 9 months, okay? You push it out, and let's be honest, no matter how you deliver that baby, it ain't fun. Okay, so you've delivered that baby, and now your muscles are in a state of, I got to protect myself, or I've been overworked, right? I've been weak. I've been holding this baby up for 9 months. I am tired. And a lot of times what happens is these muscles go into spasm. Let's add something in addition to that. Okay, so you've just delivered a baby. You have a weak core. You have weak pelvic floor muscles just because they've been worked very hard, right? And when I say worked, it's because they've been under tension. Does that make sense? So just because they've been holding a baby up does not make them strong. Okay, it's been under tension. When you have this 6-week period, at least 6 weeks, that you're not doing anything with your pelvic floor, and that's actually a hot topic in pelvic floor physical therapy right now, is, do we need the full 6 weeks? And I can dive into that a little more as well. But when it comes to those 6 weeks postpartum, a lot of women think they can't do anything. And what's happening is, it's the only muscle in our body where we have an injury and we decide not to do anything with it for 6 weeks. Okay. If I were to have an orthopedic patient come into my clinic, and let's just say they strained their calf, guess what I have them do within 48 hours of straining their calf? They work the calf. Pelvic floor is the only group of muscles that we don't do that with. And that's a problem. So now we have these muscles that have gone through some major trauma, and now we put them on isolation for 6 weeks. Do we really think they're going to function the way that they did when we just are like, oh, 6 weeks is over, let's go have some fun? No, they're not going to function the same way. And so that's why women have these changes, and not every woman, but women have these changes after they have a baby. And that's why getting back to intercourse is hard and painful. And a lot of times women think that's just normal because they expect that, oh yeah, things are just going to be different, or oh, I just need to add lube. That there's so much more to it than that. It's not just lube. It's not just forcing yourself to get back into it. A lot of times what we have to do is tell these muscles that they can relax. And that's what I do as a pelvic floor physical therapist when it comes to painful intercourse. As we take a peek at these pelvic floor muscles that have gone into spasm out of protective mechanisms because of all the damage that they've gone through, and we work on calming them down, and we work on strengthening appropriately, and that gets women to enjoy intercourse and have pain-free intercourse. And if for some reason they did have pain again, give them the tools to get through it and to give them the tools to manage it. And I want to say it's beautiful, because to be able to give someone that part of their life back is super important.
Yeah, I feel like a lot of women struggle in that arena. And like you said, who knew that you needed, those muscles to be worked after a baby? That is not something that we teach. I've been a nurse for 22 years. That is not something we even broach. Nothing. You go home and do your thing with the baby.
I have diastasis recti.
Yeah.
Which for people that don't know, it's like the separation of the abdominal wall after babies, after 2 C-sections, pretty close to each other.
Mm-hmm.
And now we do have a machine called the M-Sculpt. It is the only FDA cleared device that helps with diastasis recti. And after using it, and you can work out and do things to help with that, but this is really dramatic. It really knit me back together. And it is amazing how technology is starting to catch up with what,
the body really does.
Yeah. And that's a good one post baby, because you can do it as intensely or as mildly as you want. And it's even safe up to 80 years old.
Wow.
Yeah.
Which I keep saying we need this in nursing homes, because just think of how much that could reduce falling.
All the atrophy. Yeah.
In those.
Oh, yeah.
But I'm sure
ahead.
You have exercises and things that are replicating that kind of vibe. Is that part of what you're looking at?
Yeah. So there's a couple things we look at, right? So I think that technology is phenomenal, especially for women that if they didn't give themselves the appropriate care prenatally and postpartum, right? So when it comes to diastasis recti, folks, it always can be improved upon. Okay. So I always want to tell people, no matter how far you are postpartum, it is something that can be improved, but that the amount of gap there is may not change as much as you want to. Does that make sense?
Sure.
So for everyone, when we were talking about diastasis recti, just like what we were saying, it's separation of abs horizontally and vertically. So what I mean by that is typically what people think of is just like when they feel their muscle wall, they feel how far apart the abs are. But actually, when a pelvic floor physical therapist goes to evaluate this, we look at depth as well, because that tells us the integrity of the tissue. And so when it comes to the physical therapy world, there's a couple things that we do to, one, help prevent it, and then also to help treat it once it's there. And I'd say one of the biggest things you can do to help prevent diastasis recti is start with some pelvic floor physical therapy while you're pregnant. Doesn't necessarily mean that we have to do a whole bunch of internal work. Honestly, I always tell people internal work is only a very small portion of my job. A lot of it we still do externally. So I always say to my mamas to be, the sooner you can get into a pelvic floor physical therapist, the better. And even if it's just to give you some tips and trips on how to engage your abdominals correctly, and then also to protect your abdominals, right? Because I'm pregnant right now, I'm 32 weeks pregnant. And so I have to really watch my abdominals when I go to pick up my toddler who's 30 pounds, right? Which I kind of laughed. My OB the other day told me like, oh, you shouldn't be lifting more than 20 pounds. I'm like, I have a 2.5-year-old. Like, there's no way I'm not going to be picking up more than 20 pounds, right? Like I have a 2.5-year-old that I have to care for. So not only do we have exercise, right? Prepartum and postpartum. We also there's abdominal binders out there. It's one of those one small things you can do postpartum just to kind of help encourage everything to grow back together. But I'm going to always tell people an abdominal binder is only as good as the work you're putting into it. So if you're going around your house wearing an abdominal binder and you're not doing anything to engage your abs, it's not going to get better.
Yeah, very interesting.
So do you have you've given us water tips.
Yeah.
Do you have other pelvic floor tips that you'd like to share with our audience?
Yeah. Let me think of some goodies here.
What are your favorites?
What are my favorites? Okay, here's a good one. So let's talk a little bit. Here's a goodie. When it comes, and this actually relates to pain and urinary problems. Okay. So one of the biggest contributors to pelvic floor pain, but also a big contributor to urinary leakage, is how we breathe. So if we think about the pelvic floor, right? I talked about how the pelvic floor is those muscles that hold those organs in your abdominal cavity, right? But that's only part of your pelvic floor. So I call that actually the base of your pelvic floor. That's anatomically your pelvic floor. But really everything that relates to your pelvic floor goes from your diaphragm. So that's the muscles under your lungs, okay? That's the muscle that helps you breathe. But it goes from your diaphragm, your abdominal cavity, down to your hips, okay? So if you think of that whole like rectangle, it's almost like a corset, right? So a lot of reasons we have pelvic floor problems is because of poor pressure management in our abdominal area. And part of poor pressure management is actually our breathing techniques. So I don't know about you, but I know a lot of stressed out moms or stressed out women in general. And do you know what we all do? We all breathe with our chest. So that's when we're like, right? Those are the people that breathe and their shoulders go up and down. Okay. Fun fact, your shoulders aren't supposed to move when you breathe, right? So everyone just take a moment. We're going to look at our breathing pattern. So if you take a moment, put a hand on your chest and put a hand on your belly, okay? You can do this in sitting. I always have my clients first do it laying down. So if you're at home and you want to take a moment to get comfy and lay on the floor, please do, okay? So when you breathe, I first just want you to breathe normally. And that when you do it, I want you to think about, is my hand on my chest moving or is my hand on my belly moving? So go ahead, everyone, just take 2 breaths for a moment and try that. All right, so take a moment and kind of assess that, okay? The breathing pattern we use to teach diaphragmatic breathing is in through the nose, out through the mouth, okay? So when you think about it, you're going to take a deep breath in through your nose, nice and slow. And then when you exhale, you're going to breathe out like you're blowing through a straw. Okay. Now here's the thing you want to happen. You want the hand on your belly to move before the hand on your chest moves. In an ideal world, that hand on your chest doesn't move. But I never start people there. I want to get the belly to move beforehand. So go ahead and try it again for me. So everyone put a hand on your chest, hand on your belly. Okay. When you take a deep breath in through your nose, I want you to think about pushing that belly out into your hand. Good. Keep your chest as still as you can and blow out. Good. Do that one more time. Excellent. So one thing people can start doing to help with pressure management is start working on this breathing pattern. So one thing that we see when it comes to urinary leakage is, okay, the jumping jack scenario that we were talking about earlier. Someone's doing jumping jacks and they leak or they pee themselves. Fun fact, it's probably because they're holding the breath when they do the jumping jack. So when you hold your breath, all that pressure in your abdominal region for your holding of your breath, the pressure needs to come out through your mouth. And guess what? If you're not breathing, there's only one way for that pressure to come out, and that's through your pelvic floor. So you're going to leak. All right. So I always tell people, start with this breathing pattern. Set a timer 3 to 5 minutes a day. This is also fantastic for stress management. And so lay down before you go to bed at night and do 3 to 5 minutes of good belly diaphragmatic breathing and start working on that throughout your day. If you start feeling stressed, do a couple of those breaths. That's going to really help you manage the pressures in your intra-abdominal cavity better. But more importantly, it may help you stop leaking and stop having as much pain during intercourse.
Yeah, that's
Awesome.
amazing.
Such a simple thing.
Yeah, great tips. I love breathing.
Actually,
Breath work.
I learned how to breathe like that in yoga years ago. That's one cool thing about a lot of yoga has that kind of ingrained in it.
Yeah.
Mm-hmm.
Where like in the beginning, they would always start us exactly how you had us start with, where we're like paying attention to where the breath is coming from.
Exactly. And a lot of yoga, fun fact, is actually a lot of yoga ties into pelvic floor physical therapy. Actually, one of the things I always do is with my pregnant mamas, with my pelvic floor patients, my encouragement to them outside of the clinic and outside of the exercises I have them do is to try some yoga, to get doing some yoga, because it's such a good one. It makes you focus on your breath, but two, it helps with a lot of down regulation. And I always tell people, when it comes to pelvic floor, we're not talking about these massive changes, right? These are really simple day-to-day things that we can make an impact on and make a change on that's going to change your life, right? So when you go to a pelvic floor physical therapist, you shouldn't feel like you're having to do everything out the wazoo to get better. It's usually taking some really nifty tips and tricks, taking some things that are really applicable to your daily life and putting them in there and watching the changes work.
Awesome.
I love it. How can somebody who wants to work with you get a hold of you? What's the best way for them to find you?
Yes, ma'am. So for one, you can find me on social media. So I'm on Facebook and Instagram. That's Resilient Training and Rehab. I'm located in Wentzville, Missouri. If you are a Missouri resident, I can actually treat you virtually as well. So if you have questions, you're just like, I can't really get to Wentzville area, but I'd love to be seen. Feel free to, you can find me on social media. You can email me at resilienttandr@gmail.com. But also you can call or even text me, fun fact, at 636-486-9907. So that is my phone number that you can call me at for my business. But if someone calls me, I'm always saying, hey, you can always text me too. Easy peasy lemon squeezy. I'd like to make contacting me as easy as possible.
Awesome.
Wonderful.
Awesome. How do you recommend, if someone's not in the area, for them to find someone that does the type of work that you're doing? Let's say they live in the beautiful state of Alaska and they need some help.
Yeah. So if you're somewhere that's not in the state of Missouri, what I would tell you is, first thing you're going to do is look up pelvic floor physical therapy in my area. You can always talk to your local MD or OBGYN or referring provider. Chiropractors are also referring providers. So if you have a chiropractor that you know and love, feel free to talk to them as well. Not every physical therapist does pelvic floor, so it is something that you kind of have to dive into a little bit on who is a pelvic floor physical therapist. However, because it's such a hot commodity right now, a lot of physical therapy clinics advertise if they have it. So if you're, let's say if you're in the state of Alaska and you're going and looking it up, make sure you say pelvic floor physical therapy near me. And then also you can get a recommendation from your MD, PCP, OBGYN, or chiropractor.
Awesome. Is there anything that you think honestly, I think we should have her back again.
Yeah. Oh, heck yeah.
Please do. I love to come back.
So much, like, gosh, there's like a million topics we could just funnel off on. So we'll try to make that happen as well. But is there anything critical that you think we missed that maybe you want to like say a few words about, or you think we can save that for the next time?
Yeah, I would love to leave some ending thoughts, but there's so much, ladies, that we can dive into. But I think what I want every person listening to this to know is, if you are having pain, if you're having urinary urgency or frequency, don't chalk it up to normal. Just because your friends next to you are saying that they have it doesn't mean it's normal. And to all my women that are experiencing pain with intercourse, I want you to know it doesn't have to be that way. Okay. It's a topic that no one likes to talk about. It's a topic that's hard to talk about. And so what I want people to know is that hope isn't lost. There is something that can help you. And there's people out there that want to help you. And so pelvic pain is one of my areas of passion. And so if you're in the area and you have a question, please don't hesitate to reach out to me. I make it as not awkward and as fun as I possibly can. So, but it's one of those that you should not have to deal with the pain. And just because you have it, don't chalk it up to just external factors. It can be worked on, it can be improved, and you can improve a significant area of your life.
Awesome. Wonderful. Thank you so much for being on here. Listeners, we just would appreciate you if you like, subscribe, and share this podcast with your friends. And if you feel so inclined, leave us a great review. We appreciate you.
Yeah, thank you so much for having me. I look forward to coming back.
Thank you as well.
We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health-related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new health regimen. Remember, your health is your responsibility, and it's always best to consult with a healthcare professional.